Michelle Johnson is a 47-year-old female with history of hypertension, atrial fibrillation, hyperlipidemia, and diabetes mellitus type 2 presents to the emergency department with chief complaint of altered mental status. Patient is a poor historian upon presentation and is unable to describe recent events. Associated signs and symptoms include atrial fibrillation and hypertensive crisis. No recent hospitalizations. Complete laboratory panel completed finding profound hyperglycemia at 840 and serum osmolality at 350, admitting to critical care unit for treatment of severe hyperglycemia.
Hi there, Michelle. My name is Will. I'm going to be your nurse today. How are you feeling?
Oh, thank goodness someone's finally here. I've been feeling terrible, like I'm about to pass out. My BP is through the roof, and my heart is all over the place with this atrial fibrillation. It's a mess, really. I just want to feel better and get out of here.
Yeah, I completely understand. So that's why I'm here. I'm actually your nurse today, so I'm going to be helping giving you some medications. Is that okay with you?
Okay. I guess if you have to. But can you please explain what medications you're giving me? I need to make sure they're the right ones. I'm already worried enough about being in this hospital.
Yeah, no worries. We can go over each one of them one by one. So I do know that we have some amiodarone that's due. We have lisinopril that's due. We have insulin for your help with your diabetes. And we have influenza vaccine that your doctor wants you to get. And that's right now we have to check your vital signs first too, just to see what else is appropriate.
Oh, I don't know about that influenza vaccine. Is it really necessary? I mean, I'm not sure if it's safe for me with all my other conditions. Can you check with my doctor? I don't want to take any chances. As for my vital signs, I hope they're not too bad. I've been feeling so off lately. I can't even keep track of all these abbreviations. BP, AFib, you name it. Just tell me if everything's all right, please.
Yeah, no worries. We can make sure everything's all right. And I'll talk to your doctor more about the influenza vaccine, okay? But we can hold off on it for now.
Thank you. I appreciate that. I already have a laundry list of medications to worry about, so adding another one to the mix is overwhelming. And let's not forget my glucose levels. They've been all over the place. I can't wait to hear what my A1C is. I just want to get out of this hospital and back to my family.
Yeah, let's actually check your blood glucose real quick while we're at it, because we do have some insulin that's due. So we're going to give you some blood. So we're going to give you some insulin depending on, what your glucose levels are. So I'm going to check it here.
Oh gosh, not more poking and prodding. Fine, go ahead and check my blood sugar. I hope it's not too high again. I don't want to deal with more insulin. I'm tired of all these meds and tests. Can't we find a solution that doesn't involve all these abbreviations and injections?
Yeah, I understand. So your blood sugar is 220. So you do need to get you some insulin. It's just to make sure you don't go back to your HHS episode where you came to the hospital for. So right now your blood pressure is also really high. So we're going to get you some blood pressure medication, okay?
Oh no, my blood glucose is still way too high? And my BP is off the charts? I can't believe this. I thought I was doing everything right, taking my medications and monitoring my diet. This hospital visit was supposed to help me get better, not worse. I feel like such a failure.
Well, no worries. We're going to make it better, okay? So I'm going to go ahead and grab some medication. Can you go ahead and sit up for me? We're going to go ahead and grab some medications, okay?
Okay, but can you make sure you check the medication labels carefully? I don't want any mix-ups or potential drug interactions. I'm already on a cocktail of meds, and I can't afford any more complications.
No worries. Of course, I'm going to triple check everything for you. Just taking your temperature here. All right, temperature's okay. I'm going to go ahead and take a quick listen to your lungs, all right?
Oh, I hope my lungs are fine. I can't handle another abbreviation on the list of things that could be wrong with me. It feels like I'm drowning in a sea of acronyms and jargon. Can you please just tell me if everything sounds normal? I need some reassurance right now.
Medications for you, so that way we are completely accurate. Can you go ahead and tell me if you have any allergies?
Yes, I'm allergic to lisinopril. It caused a severe reaction last time I took it. My BP dropped, and I couldn't breathe properly. It was a nightmare. So please double check the medication list and make sure there's no lisinopril in there. I can't handle any more complications right now.
All right, Michelle, so I'm going to go be right back with your medications. We're going to get you some labetalol because your blood pressure. Okay, are you having any symptoms?
Symptoms? Well, other than the fact that I'm stuck in this hospital bed, anxious as hell, and drowning in acronyms, I suppose my pounding head and racing heart could be considered symptoms. I'm tired, scared, and I'm desperate for some relief. Can you please bring me some pain meds? I can't handle this anymore.
Yes, of course. When did your pain start?
The pain started a couple of hours ago.
Yeah, and on a scale of 1 to 10, how bad is your pain?
Oh, it's definitely up there on the scale. Probably a solid 8. It's just been relentless, and I can't shake this feeling of unease. I've been dealing with enough abbreviations in my life already, and now this excruciating pain just adds to my anxiety. I really need something to take the edge off, like ASAP.
All right, well, I'll be right back, okay? All right, Michelle, so we have the medications here. So can you go ahead and lift up your left arm for me?
Okay.
All right, can you tell me your name and date of birth?
Oh, sure. It's just, I feel so overwhelmed right now. Can we just focus on getting me better? I'm tired of all these tests and questions. I'm experiencing less pain. Thank you.